2006, one of the most comprehensive planning efforts ever undertaken in the Pikes Peak region began. Development of the Fort Carson Regional Growth Plan was coordinated by military leaders and the Pikes Peak Area Council of Governments to help the region prepare for rapid military growth and deployments at Fort Carson. At the time, planning activities of this nature and scope were virtually unheard of anywhere in the country.
We were the second agency in the country to receive funding from the OEA to look at base growth related to base realignment and closure.
The plan and its implementation was guided by scores of military, government, business, and nonprofit leaders who wanted to be sure that the resources needed to support those who have served us so well would be in place.
We've been doing this for more than 6 years, trying to ensure that as Fort Carson has doubled in growth over the past 5 or 6 years, how we make sure that we address those needs both within the community and for Fort Carson, whether that's transportation needs, family needs, schools, childcare, and across the board.
Visual evidence of the success of this initiative can be seen in the existence of new homes, schools, and roads. About $200 million worth of projects that were fast-tracked on an unprecedented basis.
When you're having these types of discussions and planning, you don't start seeing things materialize until 10 or 15 years later. And then by that time, when you do break ground, the needs have changed. In this process that we just went through, it was pretty quick, which is out of the norm.
The best evidence of the project's success can be heard in the gratitude expressed by military members who say that they have received so much support, both inside and outside the gates of Fort Carson.
I have two autistic children. One of them's in middle school, one of them's in first grade. So the schools in the Widefield School District, the counselors out there are great. They've really stepped up and helped us out.
It's a very unique relationship that the military has with the community here, unlike anything else I've ever seen in my other 32 years of service. You're not only just brought into the community, but you feel like you're part of the community here.
With the wrap-up of the Military Impact Planning Program in 2013, the baton has been passed to the community. Programs like the Peak Military Care Network, a collaborative effort including the region's leading behavioral health and social services providers, is developing a system to ensure seamless access to a range of services for military members, veterans, and their families.
When people come into the network, they don't come in with a single problem, just jobs. It's child care, it's education, it's training, it's some brush with authority. That may require first responder. It could be PTSD, TBI, traumatic brain injuries. It could be alcohol, drug abuse, child or spousal abuse. There are problems all over the community, and that's what we're trying to solve.
Over the past 6 years, so much of the success in solving problems and meeting need has been due to the strong partnerships forged between the military and the community. As we look to the future, we are excited about the opportunity to build on this success and to further strengthen the region's reputation as among the very best military homes in America.